Hey runners, do you have one of these things lying around your house and have no idea how to use it? Or maybe you're just massaging random parts of your body? If so, I'm going to show you the 7 best places that you can use a percussion massager to decrease pain, improve blood flow, and recover faster in this video. So check it out. Hey runners, the first muscle we're going to target is your quadriceps, your front thigh muscle. So you're going to use a percussion massager. There's many brands out there. They all do pretty much the same thing. They have multiple speed settings on the back and multiple changeable heads that you can use. For this one, you're going to use the flat headpiece for your big, large muscle areas like your quad. So you're going to turn it on in the back. That's going to start the percussion. Now, what you're going to do, your quadricep runs right along the front of your thigh. So you're going to move along the lateral side, so the outside part of your quad, down the middle of your quad, right along the medial part of your kneecap, and then you're going to move up the thigh. Now you might be wondering, how hard should you push when you have this? If you're just getting used to it, it can feel kind of silly, can make you laugh a little bit, so you might not want to push that much as you get used to it. But if you really want to get the benefit of a percussion massager, better blood flow, faster recovery, reduction in lactic acid, you want to add some pressure down through the device as you move through the muscles. Now, you're going to find some tight areas, particularly on the outside of your thigh as you get close to your IT band. When you find a knot, right, a tight area, you want to add pressure down into that tissue and you want to hold. And then you move a little bit, you hold maybe 10 to 20 seconds at each location, and you move along that muscle till you feel it release. If you want to go more intense, you just hit the button again, add speed, and that'll give you a better recovery. So the first muscle we did is the quadriceps. You know that one. It's commonly tight and runners get really sore after you do a hill workout or speed workout. So you're going to want to spend some time after your run using the massager there. And I say after the run on purpose. So you might feel like you want to use it before the run. You can do that if you feel tight, but you're going to get more benefit using it after your run to reduce lactic acid and recover faster so you're ready for your next run. That's going to be the best place to use it. The next place we're going to use it is in your gluteus medius, your side butt muscle. Let's dive in. All right guys, for this one again, you're going to use this flat headpiece. What you're going to do, you're going to find your gluteus medius, which sits in this circle on the side of your hip. If you find your hip bone, it's going to be right below that. So again, you're going to turn on the massager. You don't want to hit the hip bone. This doesn't go over bones, just muscles. You want to come right here. If this is your hip bone, the big one that you can feel, and this is the top of your hip, you want to go right in between both of them and just slightly backwards. And there you're going to run just like a U shape or upside down U. And you're just going to massage back and forth on your gluteus medius. You can even do this on your side, like lying on your side can hit that muscle. You can cross your leg over. There's multiple different variations, but standing is the way I find to hit it best. And just slightly behind is the place you're likely to feel more of the tension. So one of the things you might be wondering is, how long do you spend massaging each area? The general rule is till it feels better or till you feel the tissue release. That might be 10 seconds, it might be 2 minutes. You'll be the judge of that. But when you find those knots, those really tight balls of muscle tissue, you want to add pressure and hold it in that location, probably about a minute, minute and a half, and at some point you're going to feel that tissue release, and that's when you can move on to the next muscle group, which we'll be doing here. We're going to move in to your IT band, the side leg muscle. If your percussion massager comes with different attachments, for the IT band, you're going to use the dual-pronged attachment. This, I found, is able to dig into the IT band just right and able to really get good release on that tissue. So go ahead, put the double-pronged tip for this one. Okay, so your IT band runs here along the outside of your leg. Your gluteus medius, your side butt muscle, actually becomes the IT band tissue as it runs down the side of the leg. So with your massager on, you're going to start up here, right below this hip bone. Don't go on the bone. And then you're going to go down the side of the leg. As you get near to your kneecap, that's where you're really going to feel some of the tightness. And because the tissue is pretty thin, you might not be able to push it as much, so you might need to angle the massager to dig into different areas without it bouncing on you. And you can go slightly in front and slightly in back to get both parts of the IT band. Don't go over your knee bone. And again, when you find those knots, you're gonna hold, which is probably gonna be down here by your knee. And you're gonna hold 10 seconds or so and then move on to the next location. So the next area of the body we're gonna hit is the calf and Achilles. You can do these two together, and again, I liked the dual pronged head for the calf. You can also use the flat head if you want, but this one you get two birds with one stone, because when you get down to the Achilles can run right between these two, and that can work really well if you're having any Achilles tendonitis or Achilles pain after your run. Now, getting to this area can be kind of tough, so I'm gonna show you the way I like to do it to make sure you get the best value and the most advantageous push on the device for a better release of the tissue. All right, so here I have my leg up on the table. This allows me to push down into the calf and allows me to get the right angle on the Achilles. So box, table, side of a couch, whatever you have at home. You're gonna start up here in the calf. You can focus first on the outside by going along the lateral head of the calf. And you can get some of the outer muscles of your leg, called your perineal muscles. Then you can go medial side and get the medial head of the calf. Both of them can often get tight after a run. But then, and this is the bread and butter here, you want to come right in the middle, and the dual prongs are going to straddle the Achilles as you come down into the lower part of the Achilles. Don't go onto your heel bone, but just stay right through this area here and go up and down on your Achilles to get a really good massage of the tissue. The next area we're gonna hit is your plantar fascia, the bottom of the foot. If you're ticklish, you might want to avoid this one, but if you're up for it and you're okay working through that, then this can be a really good way to decrease foot soreness, especially after your long runs. So here you're going to use the dual pronged tip again, but you're only going to use one side of it. Your foot is too small to use both without hitting your the bones of your foot. So here you're going to cross your leg over. You're just going to use one of the sides. I like to pull the big toe back to expose the fascia, and then from there you can run right along where you see that tissue come out on the bottom of your foot, and just run up and down. Don't go over your heel bone. It can be pretty sensitive, so work your way into it. You're gonna find little nodules and knots. Hang out there and hold to get a good massage on this tissue. All right, runners, the final muscle we're gonna hit is your hamstrings. This one, again, is in the back of your leg. It's a little tricky to get to. I would use the dual pronged tip again. You can also use the flat head if you like, but let me show you how to get all parts of the hamstring to release tension after a run. Also, runners, before we get to that final massage area, if you like the video so far, go ahead, like, subscribe, hit the notification bell to make sure you get access to more of my videos. I would appreciate it. All right, so your hamstring sits here. This is the front, this is the back of your leg. You're gonna take the massager, you're gonna start on the outside part of your thigh and run all the way up the lateral hamstring, up and down, and then you're gonna have to rotate your arm backwards and you can get to the medial side of the hamstring. And you wanna press in pretty deep with this one. Your hamstring's thick, big muscle. You wanna press in deep to make sure you get all parts of that tissue, and then especially you want to get way up by where your sit bone is, just beneath it. That's where your hamstring tendon is, common site of tendonitis. You want to get the massager deep in there and just hold to get the best release. All right, so those are the areas I would always hit after a long run, after a hard run. If you get tightness, if you want to increase your blood flow, you want to recover faster, you want to improve lactic acid release, and you want to make sure you get out of pain quickly after hard runs, then those are the areas you're going to hit. That's how you use a percussion massager to make sure this does not just sit at home under some clothes, but that it actually gets used. It's a super cool device, and the more you get used to it, the harder you can press to get the most value. All right, runners, thanks so much for watching. On screen, you're gonna see my favorite warm-up drills that you can use as a runner to make sure you're ready to run, so that after a run, you can use this for recovery. Until next time, guys, train smarter and perform better.